Question 1. Beta blockers commonly cause A. Tachycardia, B. bradycardia, C. Hypertension, D. Fever. Correct answer: B. Bradycardia. Question 2. Which side effect is common with beta blockers? A. Insomnia, B. Dry cough, C. Fatigue, D. Diarrhea. Correct answer: C. Fatigue. Question 3. Beta blockers can cause A. Increased heart rate, B. Decreased heart rate, C. No heart effect, D. Irregular breathing. Correct answer: B. Decreased heart rate. Question 4. Which respiratory effect can beta blockers cause? A. Bronchodilation, B. Bronchospasm, C. Hyperventilation, D. Sneezing. Correct answer: B. Bronchospasm. Question 5. Beta blockers are commonly used to treat A. Hypotension, B. Hypertension, C. Fever, D. Infection. Correct answer: B. Hypertension. Question 6. Which side effect occurs due to decreased cardiac output? A. Headache, B. Fatigue, C. Fever, D. Rash. Correct answer: B. Fatigue. Question 7. Beta blockers may cause A. Hyperglycemia, B. Hypoglycemia masking, C. Diabetes cure, D. Hyperkalemia. Correct answer: B. Hypoglycemia masking. Question 8. Beta blockers may cause cold. A. Feet and hands, B. Eyes, C. Nose, D. Mouth. Correct answer: A. Feet and hands. Question 9. Beta blockers reduce A. Heart rate, B. Temperature, C. Appetite, D. Oxygen. Correct answer: A. Heart rate. Question 10. Which condition worsens with beta blockers? A. Asthma, B. Fever, C. Anemia, D. Infection. Correct answer: A. Asthma. Question 11. Beta blockers may cause A. Weight loss, B. Weight gain, C. Hair growth, D. Tall height. Correct answer: B. Weight gain. Question 12. Which is a CNS side effect? A. Dizziness, B. Cough, C. Rash, D. Vomiting. Correct answer: A. Dizziness. Question 13. Beta blockers can cause A. Hypotension, B. Hypertension, C. Hyperthermia, D. Seizures. Correct answer: A. Hypotension. Question 14. Which symptom occurs with low heart rate? A. Fatigue, B. Fever, C. Rash, D. Sweating. Correct answer: A. Fatigue. Question 15. Beta blockers may cause A. Depression, B. Euphoria, C. Hallucination, D. Anxiety. Correct answer: A. Depression. Question 16. Beta blockers reduce A. Blood pressure, B. Oxygen level, C. Temperature, D. Sugar. Correct answer: A. Blood pressure. Question 17. Which is a cardiovascular effect? A. Bradycardia, B. Rash, C. Vomiting, D. Fever. Correct answer: A. Bradycardia. Question 18. Beta blockers can cause A. Erectile dysfunction, B. Increased libido, C. Hyperactivity, D. Anxiety. Correct answer: A. Erectile dysfunction. Question 19. Which metabolic effect occurs A. Hypoglycemia masking. B. Hyperglycemia. C. Diabetes cure. D. Ketoacidosis. Correct answer. A. Hypoglycemia masking. Question 20. Beta blockers cause decreased A. Heart rate. B. Temperature. C. Weight. D. Respiration. Correct answer. A. Heart rate. Question 21. Which side effect is common? A. Dizziness. B. Fever. C. Rash. D. Bleeding. Correct answer. A. Dizziness. Question 22. Beta blockers may cause A. Shortness of breath. B. Fever. C. Vomiting. D. Rash. Correct answer. A. Shortness of breath. Question 23. Beta blockers decrease A. Blood pressure. B. Blood sugar. C. Temperature. D. Appetite. Correct answer. A. Blood pressure. Question 24. Which is a severe side effect? A. Bradycardia. B. Headache. C. Dry mouth. D. Fever. Correct answer. A. Bradycardia. Question 25. Beta blockers can cause A. Cold extremities. B. Fever. C. Rash. D. Sneezing. Correct answer. A. Cold extremities. Question 26. Beta blockers may worsen A. Heart block. B. Fever. C. Anemia. D. Infection. Correct answer. A. Heart block. Question 27. Which is a respiratory side effect? A. Bronchospasm. B. Sneezing. C. Cough. D. Runny nose. Correct answer. A. Bronchospasm. Question 28. Beta blockers reduce A. Cardiac output. B. Oxygen. C. Temperature. D. Weight. Correct answer. A. Cardiac output. Question 29. Beta blockers can cause A. Hypotension. B. Hypertension. C. Fever. D. Rash. Correct answer. A. Hypotension. Question 30. Beta blockers may cause A. Fatigue. B. Fever. C. Rash. D. Sneezing. Correct answer. A. Fatigue. Question 31. Beta blockers decrease A. Heart rate. B. Appetite. C. Oxygen. D. Weight. Correct answer. A. Heart rate. Question 32. Beta blockers may cause A. Dizziness. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Dizziness. Question 33. Which is a cardiac effect? A. Bradycardia. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Bradycardia. Question 34. Beta blockers can cause A. Hypotension. B. Hypertension. C. Fever. D. Rash. Correct answer. A. Hypotension. Question 35. Beta blockers may cause A. Cold hands. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Cold hands. Question 36. Beta blockers reduce A. Blood pressure. B. Temperature. C. Weight. D. Appetite. Correct answer. A. Blood pressure. Question 37. Beta blockers may cause A. Depression. B. Euphoria. C. Anxiety. D. Hallucination. Correct answer. A. Depression. Question 38. Beta blockers may worsen. A. Asthma. B. Fever. C. Infection. D. Anemia. Correct answer. A. Asthma. Question 39. Beta blockers can cause A. Fatigue. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Fatigue. Question 40. Beta blockers decrease A. Heart rate. B. Temperature. C. Appetite. D. Weight. Correct answer. A. Heart rate. Question 41. Beta blockers may cause A. Dizziness. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Dizziness. Question 42. Beta blockers cause A. Bradycardia. B. Tachycardia. C. Fever. D. Rash. Correct answer. A. Bradycardia. Question 43. Beta blockers reduce A. Cardiac output. B. Oxygen. C. Weight. D. Temperature. Correct answer. A. Cardiac output. Question 44. Beta blockers may cause A. Cold extremities. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Cold extremities. Question 45. Beta blockers may cause A. Hypotension. B. Hypertension. C. Fever. D. Rash. Correct answer. A. Hypotension. Question 46. Beta blockers may cause A. Fatigue. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Fatigue. Question 47. Beta blockers may worsen A. Heart block. B. Fever. C. Infection. D. Anemia. Correct answer. A. Heart block. Question 48. Beta blockers may cause A. Depression. B. Anxiety. C. Euphoria. D. Hallucination. Correct answer. A. Depression. Question 49. Beta blockers may cause A. Dizziness. B. Fever. C. Rash. D. Vomiting. Correct answer. A. Dizziness. Question 50. Beta blockers decrease A. Blood pressure. B. Temperature. C. Appetite. D. Weight. Correct answer. A. Blood pressure. Question 51. Beta blockers may cause which gastrointestinal side effect? A. Constipation. B. Nausea. C. Ulcer. D. Bleeding. Correct answer. B. Nausea. Question 52. Beta blockers may cause which sleep-related issue? A. Insomnia. B. Coma. C. Sleepwalking. D. Narcolepsy. Correct answer. A. Insomnia. Question 53. Beta blockers can reduce A. Renin release. B. Insulin release. C. Bile secretion. D. Saliva production. Correct answer. A. Renin release. Question 54. Beta blockers may cause A. Exercise intolerance. B. Increased stamina. C. Hyperactivity. D. Muscle growth. Correct answer. A. Exercise intolerance. Question 55. Beta blockers may lead to A. Slow pulse. B. Fast pulse. C. Irregular breathing. D. Fever. Correct answer. A. Slow pulse. Question 56. Beta blockers may cause A. Dry eyes. B. Watery eyes. C. Red eyes. D. Eye infection. Correct answer. A. Dry eyes. Question 57. Beta blockers may cause A. Reduced cardiac contractility. B. Increased contractility. C. No effect. D. Cardiac enlargement. Correct answer. A. Reduced cardiac contractility. Question 58. Beta blockers may cause A. Weakness. B. Strength increase. C. Hyperactivity. D. Muscle gain. Correct answer. A. Weakness. Question 59. Beta blockers may lead to A. Peripheral vasoconstriction. B. Vasodilation. C. Hemorrhage. D. Edema. Correct answer. A. Peripheral vasoconstriction. Question 60. Beta blockers may cause A. Sexual dysfunction. B. Increased libido. C. Fertility increase. D. Hormone increase. Correct answer. A. Sexual dysfunction. Question 61. Beta blockers may reduce A. Myocardial oxygen demand. B. Lung capacity. C. Appetite. D. Temperature. Correct answer. A. Myocardial oxygen demand. Question 62. Beta blockers may cause A. Lightheadedness. B. Hyperactivity. C. Fever. D. Bleeding. Correct answer. A. Lightheadedness. Question 63. Beta blockers may cause A. Confusion. B. Alertness. C. Aggression. D. Memory boost. Correct answer. A. Confusion. Question 64. Beta blockers may cause A. Reduced exercise heart rate. B. Increased exercise heart rate. C. No change. D. Irregular breathing. Correct answer. A. Reduced exercise heart rate. Question 65. Beta blockers may cause A. Reduced cardiac conduction. B. Increased conduction. C. No effect. D. Seizures. Correct answer. A. Reduced cardiac conduction. Question 66. Beta blockers may cause A. Hypoperfusion. B. Hyperperfusion. C. Fever. D. Bleeding. Correct answer. A. Hypoperfusion. Question 67. Beta blockers may cause A. Cyanosis. B. Jaundice. C. Pallor. D. Rash. Correct answer. C. Pallor. Question 68. Beta blockers may reduce A. Sympathetic activity. B. Parasympathetic activity. C. Immune system. D. Digestion. Correct answer. A. Sympathetic activity. Question 69. Beta blockers may cause A. Memory problems. B. Memory improvement. C. Hyperactivity. D. Fever. Correct answer. A. Memory problems. Question 70. Beta blockers may cause A. Reduced blood flow to extremities. B. Increased blood flow. C. Bleeding. D. Swelling. Correct answer. A. Reduced blood flow to extremities.